Hello, my name's Adrian Richards. I'm a plastic and cosmetic surgeon and the surgical director of Aurora clinics. In the previous videos I've talked about thigh lifts, medial thigh lifts, lateral thigh lifts, liposuction, and how they can be combined with tummy tuck procedures, extended abdominoplasties and body lifts. And in this video I'm going to be talking about some of the complications that can occur after thigh lift surgery. So it is important to fully consider any type of plastic surgical procedure, and they are operations, they do have risks, and what I would encourage you to do is think about the risks and the pros and cons of the benefits you will get following surgery and the risks that are possibly associated with them. So the first thing is, it will involve a general anaesthetic, and there are risks in general anaesthetics. Now, if you're fit and healthy and you haven't got any significant heart or lung problems, these risks are very, very unlikely. So, I think with modern anaesthetic techniques, they are really, really safe nowadays, and certainly in the last 10 years, I haven't had any significant problems of that nature, with a very experienced anaesthetist. But you can get, problems relating to the thigh lift itself. So let's just go through these, from the operation. So when you wake up from the operation, you will have dressings on the area and possibly a support garment and possibly drains inserted. The drains are just very fine tubes used to remove any excess blood from the area, normally in the first 24 hours following surgery, and they're nearly always removed, within 24 hours of surgery if you do have them. You can get internal bleeding, and that occurs if a blood vessel opens up, normally in the first 24 hours after surgery. You'll know if you have this because the area will swell and become very taut and swollen. That's why we like to keep you in hospital. If you do have this problem, your surgeon may need to remove the blood clot and stop the blood vessel. The next problem you may get is infection. This is really rare in my experience. I only use laminar airflow theatres, which are the most modern type of operating theatres, in which the air is changed regularly with clean air brought in. So if there are any bacteria in the area, they're cleaned out very quickly. And in my experience, I would certainly want any operation I had to be performed in a laminar airflow theatre because the risk of infection is so much lower. But it can still occur, and the telltale signs for infection are if you feel unwell following the operation. It normally doesn't occur immediately, so infection is occurs 5 to 10 days following the operation. So if you feel unwell, if you're getting more pain, if you feel feverish, hot and cold, shaky, any of those symptoms, you really need to contact your surgeon immediately so they can bring you back in and perhaps give you antibiotics. And in the vast majority of cases, quick early antibiotic use will nip that infection in the bud. The other things you can get in the more long term are problems with scarring. Now scarring, we can get hypertrophic scars, and I've talked about those in other videos, and perhaps it might be worthwhile having a look at some of those other videos which discuss problems you can get with scarring and measures you can take to improve the scarring as much as possible and make sure your scar heals in a very sort of thin, fine line and be as inconspicuous as possible in the future. With medial thigh lifts, it's very important that your surgeon does tether the deep layers of the skin to the fold internally, because with gravity what you can get is you can get the scar pulled down onto your inner thigh area where it can be more visible. So it might be worth just talking to your surgeon about whether they are going to use those internal tethering sutures just to keep the scar of the medial thigh lift nicely tucked in there to the fold. So overall, complications can occur. They tend to occur less with more experienced surgeons, and I would probably advise you to just ask the surgeon about the theatre they use. Is it a laminar airflow theatre? And also just check how experienced your anaesthetist is. And they should ideally be in my opinion, someone who's worked in the NHS as a consultant, because they will have the experience of looking after you and treating heart and lung conditions. So thank you very much for watching the video. If you are considering a thigh lift surgery, please feel free to send us a picture or an inquiry to our email address, and we'll be happy to give you an opinion as to the best way forward for you. And if you then wanted to, please ring us to schedule a consultation with one of our specialist surgeons who'll be able to go through the pros and cons, discuss the best technique for you to let you make the best informed decision as to whether thigh lift surgery would be appropriate in your case. Thanks very much for watching.